California EV startup Telo has unveiled a 4-door, 5-person electric pickup truck designed for urban environments and active lifestyles. The Telo truck, designed in collaboration with Yves Beher and Fuse Project, has the same length as the Mini Cooper SE, but features a longer truck bed than the Rivian R1T. The truck measures 152 inches in length, matching the bed length of the Toyota Tacoma, and includes a configurable mid-partition to accommodate longer cargo. It has a storage compartment on the side, and the option to add a truck cap for a third row of seating or a camping layout. The vehicle weighs 4,400 pounds, 2,000 kilograms, and is equipped with a 106 kilowatt-hours battery, providing a range of 350 miles, 550 kilometers, and supporting fast charging to 80% capacity in 20 minutes. The 500 horsepower, 373 kilowatt motor enables the truck to accelerate from 0 to 60 miles per hour, 96.5 kilometers per hour in 4 seconds, with a top speed of 125 miles per hour, 200 kilometers per hour. The Telo truck is available for pre-order with a deposit of US $152, and the base price is listed as $49,999. The first batch of production vehicles will be hand-built, with deliveries expected in 2025 for early adopters, before scaled manufacturing begins the following year. California startup Varda has deployed its first satellite, which serves as a space-based pharmaceuticals factory and hypersonic test bed during re-entry. Manufacturing in space offers advantages such as zero gravity and microgravity environments, which can lead to improved bioavailability, extended shelf life, and new forms of drugs. Protein crystal growth is a major area of research conducted in space, allowing for the analysis of protein structures and the design of medications. The cost of space launches is decreasing, making space-based manufacturing more affordable and accessible. Varda's satellite, about the size of a yoga ball, will conduct tests on an HIV/AIDS drug called ritonavir and examine its crystalline structure in space. After completing its tests, the satellite will re-enter the Earth's atmosphere at hypersonic speeds, Mach 25, and provide a mission-relevant environment for hypersonic R&D programs. The satellite will deploy parachutes to ensure a gentle landing, preserving the integrity of the drugs on board. Varda plans to have commercial and government clients in future missions, aiming to establish space-based manufacturing and testing as a common practice. The company envisions reusable space factory modules and a permanent manufacturing station in orbit for material transportation and maintenance. An international team of researchers has developed a 19-core optical fiber that has set a new world speed record for data transmission. The optical fiber is as thick as a human hair and carries a signal to transmit data at 1.7 petabits per second, bit per second, over a 41.6 mile, 67 kilometers cable. The technology is closer to implementation compared to previous data transmission speed records. The glass chip used in the fiber, developed by Macquarie University, plays a key role in achieving high-speed transmission with low losses. Most current optical fibers have a single core, limiting their capacity, while thicker fibers would be less flexible and require infrastructure changes. The 19-core fiber offers a solution for increased data flow at a reduced cost and has applications in various fields, such as planet detection and disease detection. The research findings were presented at the 46th Optical Fiber Communication Conference. Scientists in the UK have discovered a gene variant that causes a common type of high blood pressure and found a cure for it. The condition, known as hypertension, increases the risk of cardiovascular problems if left untreated. The cause of hypertension in some cases is aldosteronoma, small non-cancerous tumors in the adrenal glands that disrupt the production of the hormone aldosterone, responsible for regulating salt levels in the body. The researchers identified a gene variant called CADM1 within these tumors that affects the protein of the same name, leading to increased levels of aldosterone and subsequent hypertension. The study found that removing one of the adrenal glands corrected the aldosterone imbalance, and cured hypertension in patients, even in severe and drug-resistant cases. The treatment of removing the adrenal gland could be life-saving for individuals with this form of hypertension. The researchers recommend 24-hour urine tests to measure aldosterone fluctuations over time for accurate diagnosis. Further investigations are underway to explore the possibility of burning off the tiny nodules instead of surgically removing the entire adrenal gland. The research was published in the journal Nature Genetics. Oak Ridge National Laboratory, ORNL, has made a small tweak to the manufacturing process of solid-state batteries, eliminating defects in the electrolyte film. Solid-state batteries are safer and more efficient than lithium-ion batteries, as they don't contain flammable liquids, are less toxic, have higher energy densities, charge faster, and endure more recharge cycles without degradation. Defects in the electrolyte films of solid-state batteries hinder ion movement between electrodes, slowing down charging and overall performance. The ORNL team introduced a step of heating the press and allowing the electrolyte to cool under pressure, resulting in a film free from bubbles and higher in-surface nitrogen enrichment. The modified electrolyte film showed nearly 1,000 times more conductivity, close to a 50% improvement in critical current density, and enhanced stability due to better lithophilicity. The tweak not only enhances battery performance, but also paves the way for reliable processing of solid electrolytes on an industrial scale, providing engineers with more control over the manufacturing process. The research was published in the Axe Energy Letters. Scientists at the University of Gothenburg, University of Cologne, and the Czech Academy of Sciences have developed nasal drops containing a peptide called C3A, which is naturally produced in the central nervous system. Previous research suggested that the peptide could aid in restoring motor function in stroke victims. In a study conducted on mice, the nasal drops were administered 7 days after a stroke, resulting in faster and more extensive recovery of motor function compared to an untreated control group. MRI scans showed an increase in the formation of new connections between nerve cells in the brains of mice treated with the nasal drops. The nasal drops appeared to enhance the function of astrocytes, which control certain nerve cell functions. The beneficial effects of the treatment persisted even after the treatment was discontinued. Early administration of the drops after a stroke may have a detrimental effect by increasing the number of inflammatory cells in the brain. The researchers believe that this treatment could be administered to all stroke patients, including those who arrive at the hospital too late for other interventions. Clinical trials on humans are being planned. The research was published in the Journal of Clinical Investigation.